Hi, I am Dr. Veronica Carey. I am the Assistant Dean for Diversity, Equity, and Inclusion at the College of Nursing and Health Professions and an Associate Clinical Professor within Counseling and Family Therapy. The current state of mental health has grown tremendously since the mid-1900s. So allow me to go there to that space for just a moment. We had the advent of so many new psychotropic medications that have the least amount of side effects between like the 1950s, 60s, 70s. That is enabled people to have more tenure in the community. So someone with schizophrenia before might have been rehospitalized more frequently than these new medications afforded them. And then once you see success in the community, meaning people are functioning in the community, people are living, learning, working, socializing, having that evidence has been a huge impact on the mental health system. The Human Development and Counseling program is an excellent program. I wish I had it when I was in school because it's very, very skills-based. So once the students are finished all their gen eds, they come directly to us and learn about lifespan and human development, meaning how does the diagnosis impact the student? Why do I have it and my sibling doesn't have it? So we have a genetics and mental health course. We even teach them how to document. So how do you do progress notes? How do you do quarterlies? How do you do monthlies? How do you write an overall rehabilitation goal? So each one of those strategies, it's not just conceptual, they come out with literally the evidence that they need and the skill set that they need to be able to be hired immediately. So there are several courses in the Human Development and Counseling program. I mentioned Lifespan and Human Development. There's Foundations of Behavioral Health. There's Counseling 1 and Counseling 2, where you learn how to work with small groups and also individually. There's Psychotropic Medication Understanding. There's Psychiatric Rehabilitation, which is the model that I teach, and it's also substance abuse issues and substance misuse programming. The ideal student that would be fit for this program, it has to start with someone who is able to not micromanage. Micromanaging is difficult. If you see someone doing something incorrectly, you want to jump in and correct them, because we were raised that way. When we can't tie our shoes, what happens? A parental entity comes over and shows us how to tie it. If we're walking, we might trip. They come and get us and retie it for us. So individuals who are able to have not only just the heart to want to help people, but also the ability to kind of say, okay, I'm going to let that person have what we called a prescribed failure, and then we're going to help them get up. I can give you a great example. Like when I raised my own children with psychiatric rehabilitation principles, I just didn't tell them. So the idea being there is like, let's say, for example, my daughter says, I'm going to meet mommy over here at the school. And I go, okay, the best way to get there is to take this highway, this back road, and I'll see you. And she goes, no, I'm going to go my way. I'm like, okay, well, you do at 10 o'clock. When she arrives at 10:10, I'm going to say, well, you know what? What can we do differently next time? Because that didn't work, right? Yeah, you're right. I need to figure it out. As opposed to driving her or sitting with her, right? So that's how we teach the students to be successful. So students can most certainly, with the Human Development and Counseling undergraduate degree, become employed immediately. That is because not only do we teach them the skills that they need to know, but we also have adjunct professors who are hiring. So they are learning exactly what they need to know when they graduate. So if they're in the psychiatric rehabilitation program and they know they have to be able to document as well as do independent counseling, as well as small groups, they learn that. If they're going to work with individuals who have substance misuse issues, they're going to learn about prolapse and lapse and relapse. Those are 3 different terms that are relevant to that particular genre. And we find that students appreciate the fact that they can work for a couple of years and then may decide to then get a master's degree, especially if they want to go into administration or supervision. So students learn from faculty primarily, but during the class, they get to learn from their peers. There's a lot of simulation happening, a lot of role-playing happening, a lot of opportunity to have those prescribed failures. I literally say to students in class, I want you to be wrong here so you're not wrong out there. And I will correct them when they're wrong there. One of the most important things students learn is person-first language. You don't work with schizophrenics or bipolars. You work with persons diagnosed with. So Dr. Carey has schizophrenia. Dr. Carey has bipolar disorder. And that way the person realizes you're not treating me like my diagnosis, but you're seeing me as an individual. Well, my favorite course is psychiatric rehabilitation, right? Why? I like it because the United States is what's called recovery-oriented. That means that we believe people will grow beyond the day you meet them, but we already know there's no cure. Whenever you hear the word recovery, you think the persons are talking about a cure, the absence of, right? I no longer have a cold. I no longer have the flu. You're going to have schizophrenia. There's no cure for it. Our medication, our treatment, our rehabilitation, our clinical support is to mitigate the disturbance of the positive and negative symptoms, to abate them, to lessen them. The practitioners that are our students, how to get someone to function in their absence. You can't have someone who micromanages individuals and then say, now go ahead and be successful. You're going to want to lean over and go, no, don't do it, no, let me help you. But instead it's like, okay, go and catch the bus. We've already worked on all the steps to catch the bus. I'll meet you at the last destination. And then if the person's not on the bus or you miss them, you're going to say, oh, what happened? And backtrack. Oh, I didn't have the exact change. You told me to have the exact change. I forgot to put it in my wallet. So we walk everybody through everything, and psychiatric rehabilitation, evidence-based practices afford students to kind of see that, practice it with their peers, sometimes out in the community, and it's been really effective. What we're finding out is that students should choose Drexel for human development and counseling and for our MFT program, right? We have graduate program as well in counseling and family therapy, because it's skills-based. People oftentimes will major in psychology here and elsewhere, but when they take our courses as electives, if they're majoring in psychology, they end up going, but that's what I want to do. I want to learn how to work with, right? We need psychologists. Of course we need psychologists. More research, right? More psychotropic medications with the least amount of side effects. We need psychiatry and sociology. But when a person is stable in the community, you need rehabilitation. Much like if someone has hip surgery and they're finished with the clinical aspect, the first thing they do is go to OT or PT. It's the same premise. When someone is stable, what do? You help them to function more so they have longer tenures of stability. And that's what rehabilitation does. The students learn skills to help rehabilitate. And I teach the students that rehabilitation is actually 2 words. Re means to do something again. Habilitate is to teach for the first time. So students learn, is this individual learning this skill for the first time? Or am I rehabilitating them? Because maybe because of the onset of their illness, they lost some component and they have to relearn it, and you don't teach that skill the same way. So students learn how to make those levels of distinctions, and when they interview for jobs, especially in the tri-state area, and they can share the faculty's names that they interviewed with, they tend to get hired. Our students are getting the experiences that we need them to have by Horizon House. Horizon House, Inc. is a huge hirer in terms of mental health. Also Elwyn and Gadenzia and Seabrook House and Resources for Human Development. These are all opportunities, and Seabrook is in Jersey, so we know that where they can be placed. I have a student who just reached out to me to say, well, I'm thinking about getting my master's in social work, Dr. Carey, after I graduate this spring, and I want to be able to go somewhere and shadow a licensed social worker. So because we're so connected with people that are still working in the field, that's easy. I'm just going to say, well, where do you want it to be? You want to be in Jersey, upstate Pennsylvania, here, lower Pennsylvania, the suburbs? Where do you want it to be? Because we still keep that level of direct contact. Those experiences are essential. We don't want students to graduate with hypotheticals. We want them to literally have experienced it so they're very familiar. DEI is critical across the board. Right? If you don't understand what I call the 5 or 6 freedom words, if you don't know what diversity, equity, inclusion, belonging, if you don't even know what they mean, then it's going to be difficult to function within that. So whether I am doing a presentation at the podium for new faculty or new student orientation or students within the program, and across all of our colleges here at Drexel University, DEI is critical. Even if you're a math major, some people may question, well, why do I have to know DEI as a math major, as opposed to I understand why someone who's going to be working with clients and patients might need to know it. And I'm like, oh, so when you get a job as a math, whatever that field is, you're going to work autonomously? You're never going to have a peer or a coworker. Well, yeah. Well, and that coworker is going to be exactly like you are, right? Well, of course not. Well, then you need to understand that diversity plays a role, equity plays a role, inclusion plays a role, equality plays a role. So especially when it comes to mental health, where the individuals with the diagnosis oftentimes are disenfranchised or marginalized. You need to know what that means. So all these things are incumbent in all of our counseling and family therapy courses, and most certainly in my role here at CNHP, as well as in the different committees that I'm on as a part of Drexel. What excites me the most is that we have decades of evidence that people can be successful. By definition, that means functioning and satisfied with the least amount of direct practitioner intervention. So when a person's stable, they have to wait 30 days to be ill again and go back and be seen again? No, we want to march that person forward.